what I was telling you, so I shall be taking the class on biostatistics. This biostatistics is the third paper. Not, it is the second paper in the MD Home Part 1 examination. First paper is your own paper, own subject paper. And second paper is the research methodology and biostatistics. So there are two papers in that particular subject. And the part of the second paper is biostatistics, which is very much essential to know everybody. So I shall be discussing today. Yes, I shall be discussing over biostatistics. So let us, and we shall have a 10-minute discussion also later on in the end of the meeting. So first of all, I would like to convey you, I am telling you one way, because right now it is interaction is not possible, because if I go through the interaction in the beginning, it will be very slow lecture. So whatever I want to convey you, that is regarding biostatistics. So statistics is nothing but a record of data, that is called statistics. And when we study related to life, health, disease, and cure, then it is said to be biostatistics. So statistics or any type of datum which gives us information regarding any fact, measurement, which may be expressed in figure. And that is what figure? Such as you know, that weight of the baby at the birth and height of the baby at birth, choice of the color of babies, number of sweet shop in a particular area, etc. So I told you that the biostatistics is a statistics, a data which is expressed in the number, etc., is known as statistics. And biostatistics is that where we can relate it to the life, health, disease, and cure. So in this, whatever I have written here, like figures such as weight of the baby at birth. So it is related to biostatistics. Whenever birth takes place, it is usual phenomena to measure the weight of the child at the time of birth. Why? It is a phenomena because it gives us a data, a related data, that we can conclude, we can find that this is the exactly, or this is the average weight during a baby and takes birth. That is why we say that whenever a baby takes birth, we ask how much pound or how much weight of the baby. If it is a 2.5 kg, it is said to be average weight. Then it is said to be 9 pound. And if it is said to be that more than 3 kgs, then it is said that the baby is overweight. And if it is a 1.5 kg, it is underweight. So you know all the things related to the premature baby as well as low birth weight. There are lots of problems for the students of the pediatric that is to be understood. That there are so many several diseases which they invite if it is a low birth weight. So we have to be very much precautious for such babies whose birth weight is very less. So apart from that, I have given the height of the baby accordingly, so that we should come to the conclusion that what is the height, what should be the height of the baby when it takes birth, and at the same time, choice of color of the babies. Means babies are attracted towards which color, more, likewise that. So these are the statistics and biostatistics. Now I have given the number of sweet shops in the particular area. So this is a wrong data in biostatistics, because number of sweet shops does not include any life, health, disease, and cure. So it is a wrong thing I have put here, so that you should understand that biostatistics is especially related to life, health, disease, and cure. Now, there are 2 points which is to be understood, that whenever I speak, you should understand statistics is the plural of static, statistic. And second, data, which is spelling is D-A-T-A, and which is pronounced as data, or somebody may say data also. So data is the plural of datum. When we say datum, it means it is a single, only one. So that is to be understood by you. Next, let us see that biostatistics is science. We say, then you need to justify that how it is science. So there are certain criteria which is to be understood. I see that Dr. N. Lakshmi is not there. I see that Dr. Antriksh is not there. Ankesh Kumar is not there. If you are not connected, and Dr. Prakash Kwinkle also, if you are not connected with video, I shall not accept you as present in a session or in the classroom. Okay, so that is why I have requested in the beginning that everybody requires to requires to be connected with the video. Okay, however, it is up to you whether you connect with video or not. That is your problem, not mine. So biostatistics is simply collection of data of information, and what kind of information related to life, health, and disease science. So how
PG class on the biostatistics.
Biostatistics.
Part 1, part 2. Inka chinna babu anukuntunna.
I'll mute your audio, please. Yes, it is biostatistics. Everybody is requested to mute their audio, but please put on to your video.
Kushunta, nake books choose ఒకటే సంతోషపడ్డా. అమ్మా అన్నయ్య బిడ్డలకి ఇచ్చిండ్రు, నాకు ఇక సంతోషం. ఏమి చాతగానోడివి దుష్యుంట, అసలు ఆడోడై పుడితే పెళ్లి చేసి అటు పడేస్తుండే. మగోడై పుట్టినావు, ఆడోడై పుడితే పనికి చేసుకుంటా, పని మనుషులు ఇంట్లో అంతా ఒట్ట పని చేసుకుంటా ఏం చదువుకుని ఉంటే అయిపోతుంది.
Kindly introduce yourself. Who is there? Kindly mute your audio. So biostatistics is simply collection of data information related to life, health, disease, and it is a science. And why it is science? Because the data is expressed in figures. Data is expressed in figure, and it is tried to make accurate so that it may be scientific. If any data which is related to number and several other aspects also, several other variant also, and if it is a represented in that manner, then it can be said to be a scientific. Hence, biostatistics is nothing but a study based on life, health, disease, treatment, cure, etc., which is represented in figure or which can be measured. Therefore, biostatistics is science. Meaning why? That if we understand, if we know the parameter, if we understand the number, likewise, number of deaths during the month of April in 2021 in the area Bihar or Assam or Odisha in a particular locality, if it is such a specified, then it is said to be science. And accordingly, if we study that the number of deaths due to COVID, which were oxygen dependent from the age group of 40 to 60, then these 20 years variations is also a study in a particular area, in a particular time. So such a specification with such number, it gives the related data in the correct figure, since it is a correct and it can be accessed anytime. That is why it is said to be a science. Biostatistics, the presentation of the facts in biostatistics should be in such a manner that it can be easily comprehended. Why it should be easily comprehended? Because whenever we represent some data in a graphical manner or in a chart, then one can see very easily in a fraction of minutes that what is the death ratio, what is the percentage of cure, what is the percentage of efficacy of any medicine if it is represented in the data. So it should be in such a way that it should be comprehended easily, analyzed and interpreted. Just saying something about some facts without any figure is not science. Likewise, I can say that कोरोना जिसको होता है उसकी तो डेथ हो ही जाती है, या जिसको भी मच्छर काटता है उसको डेंगू हो जाता है. Likewise, it is not a correct data. It is not a correct scientific interpretation. So we need to focus over that how many persons affected with the COVID in the particular age group. That is why it is said that the third variant of the corona is coming for the smaller children or kids, because it will be studied. It is not yet known to us, and we shall be observing the facts and scientific figure in the later on. Recently, we have several issues, several types of action of the vaccine is being studied at the same time. So usually the research study in medicine is also known as quantitative medicine. What is quantitative? When we give some number, it becomes a quantitative. There are two types of study. One is quantitative and one is qualitative. So we shall know that what is difference between quantitative study and qualitative study. We have to express everything in number, such as number of death due to dengue in the year 2012. So when such number, such year, and apart from that, if I specify the area also, then it becomes more scientific. And if I want to make it more scientific even than that, then we should specify that such like number of death due to dengue in the year 2012 in the area Delhi, and in the month of especially September, or at particular locality also. So likewise, a specification of area age group also, that between the age group of 8 to 12. Likewise, study is known as the scientific study. So biostatistics, whenever we say it's related to the health, disease, treatment, cure, medicine, etc. And if such types of things is expressed in the number or area, etc., then it is said to be science. That is why it is a science. No.
Recording in progress.
Kindly mute your audio and add with us with your video on. Quantitative medicine, as I told you, quantitative medicine means when I refer to some number to a particular data, that then it is said to be quantitative. Now, if we say that usually the person die who are affected, now this is not expressed in the term of figure, so it is not a quantitative, so it cannot be biostatistics related to the scientific also. So whenever, and now if we take like that, to make it scientific, we have to study like how many persons died during epidemic of dengue in a particular area in a particular month. And if I add in the age group also, So it will be more specific, more quantitative study, and it will be more scientific. Or we may say like this, that we may say like death in children between the age group of 12 to 16 due to dengue in the month of September 2013, and especially in the area like we can add anywhere, Odisha, or we can say in Bihar or Darbhanga, like this that. So this will be more scientifically data and more scientific expression also. Now, science of variations. Now, this is to be understood that what is the science of variation. I have already taken one classes physical last week. Whosoever is present here, and the same material has been taught to them. Even then, they have joined us today because I have taken the larger group of persons or students in such biostatistics, so everybody can be benefited with such types of lecture and such types of understanding, so that they can understand that what is the biostatistics in the reality, and they should have in their mind that yes, this is the biostatistics. So biostatistics should not be something new that they are cipher, they are zero in understanding that what is the biostatistics. So now you are in a position to express yourself that biostatistics is nothing but a clinical or a scientific study which is expressed in the number related to life, health, disease, and cure. That is the main thing. So now we have to focus over the science of variation. What is this variations? That if you have gone through the several test reports like hypothyroidism, like blood tests, like blood pressure, like temperature, like pulse rate, like height, etc. But you will find, as I told you right now, that weight during birth of the baby. So there also there are several variations. Some babies are born with 2.5 kg, 2.700 grams, likewise that. So after study, 100 babies who has taken the birth, and the average weight is to be deducted, so that one should bear in the mind that if the weight is approximately 2.5 kg, then it is the average weight, and this is said to be a healthy baby. So this type of conclusion is to be drawn. So it is the science of variation, because every baby is not 2.5 kg. There may be 2.6 kg, there may be 2.4 kg, 2.8, and accordingly it's several. But an average weight is said to be that parameter should be measured. So is the case with the pathological investigation also. So normal, first we should understand that what is normal. So as you know that the pulse rate is should be 68 to 72 or 72 to 78, likewise that. So it is also how it came, because several healthy persons were examined their pulse rate and everybody was healthy. So, but there were some variations, like somebody was having 68, somebody was having 70, and some. So it can be practically experienced also. Suppose a group of PGs are here, so we can have a practical session. So everybody will count their own pulse or some other pulse, and that they will note. There will be some variation, but there will be always between 68 to 78, and this will be a healthy pulse rate during health. So that is what is said to be science of variation. Accordingly, you see the hemoglobin also, that there is some variations, that for female it should be 13 to 15 milligram. Accordingly, the male should be 14 to 17. So why this is 14 to 17, 13 to 15? Because this range is shown by the healthy persons, different persons, although they were healthy, but they were having, somebody was having 13.5, somebody was having, some female were having 14, likewise that, but all were healthy. Accordingly, for the male also, up to 70 milligram, those were found to be healthy. So such variations, and accordingly, I have written here, the study which we conduct on pathology or on normal health issues, which may be variable due to certain external influence and internal influence. So what is external influence and internal? Internal, you know, that the genotypes, and external, you know, that the environmental factor as well as phenotype, likewise that. Or they may be variable in different cases differently. Now you can be astonished that in the places, how can it be variable? But yes, It is variable. Such study is said to be signs of variation, like height. Different places, even in India, the height of Jammu and Kashmir, the height of Sardarji, Punjab is different from the average height of Biharis or Odisha or South Indian. Likewise that, so they are also healthy. If they are of 6 feet, they are healthy. If we are 5.5 feet average height, then it is said to also be healthy. So in health parameter, if there is some variations, as we know in the world scenario that Australian heights is the more height. They are 6.5 likewise. So they are also healthy. But if in India, if somebody is 7 feet, then it is said to be abnormal height. Abnormal height. But if somebody is very short height, then that is also abnormal height. So signs of variations includes that even it is a healthy condition. Excuse me. हेलो हाँ सर आधे घंटे बाद बात करिए क्लास में so signs of variations mean signs of variations means even though it is a normal, but there is some variable due to various factors like internal or external factor, genotype or phenotype, then it is said to be normal, and that we have to keep in the mind. And that is why the surveys are being done so that they can come to the conclusion that this is the normal. So different type of statistics. What are the different types? One is the health statistics. So a study related to public health and community health issues. So there are several health issues of the public and community. They are studied like how many children are affected with the chicken pox in the particular month of April 2012, 2018, 2020, like that. So this is related to community health. And how many persons were affected with the Kala-Azar in the year 1900, I can say 1999, or how many persons between the age group of 15 to 25 suffered from the Kala-Azar in the area Paschim Champaran. So that is also a study. So it is related to the public health and community health issues. And it is very much truly related to the medical science, related to a study like disease, efficacy of drugs, efficacy of particular medicine in a particular disease, a study of particular medicines in several diseases. It happens. You may be astonished right now. आपको आश्चर्य होगा कि एक दवा several में कैसे हो सकता है? But being a homeopath, you know and you understand that a single medicine can work in several types of diseases, like phosphorus, like arsenicum, like lycopodium. So they are polycrest medicines, and that particular because we work on individualization. If a particular patient is suffering from a particular disease, but if individualization is related to lycopodium, then we have to give the lycopodium in other respects. What I wanted to convey you that if a person is suffering from liver disease, and if that person is truly, with the help of totality of symptoms, if we come to know that his or her symptoms very much correlate with lycopodium, then that patient is to be given lycopodium. And accordingly, if other person is suffering also from the liver related to the disease, but that particular patient is showing the totality in accordance with the phosphorus, and phosphorus is to be given. And we know that there are several other medicines also like chelidonium, etc. So that is also to be given if you are treating therapeutically, then you can give likewise chelidonium, Chiananthus, China, etc. So if we want to study now that Chelidonium mother tincture, is it effective in the cases of jaundice or hepatitis A? Likewise that, then it is also a study. But if we study whether the homeopathy is effective in the cases of jaundice, hepatitis A or not, then there may be the several medicines. Or we can pick and choose only one medicine, lycopodium, or we can pick and choose that lycopodium 0 by 1 by the potency, whether it is effective in the cases of jaundice or not. So likewise that, we have different types of the study. So related to study like disease, efficacy of drug, efficacy of particular medicine in particular disease, or a study of particular medicines in the several diseases, likewise. And the third is vital statistics. What is vital statistics? It is related to the vital events like birth, marriage, death, etc. Such a study, if it is known, and what is the birth? It is not related to weight and height, but how many children taken birth in the particular area, particular country, particular in the world scenario also. So it gives the indications, or it gives the information regarding that in the China, how many baby takes birth in a 1 year, how many baby takes birth in 1 month in Australia or in London, likewise that. So such types of study is known as the vital study, and accordingly that how many persons die in a particular area, particular year, in a particular area, likewise that. How many persons died natural death or due to diseases, some likewise that. How many persons got married in a particular month, particular area, or in a particular religion also. So likewise, those study is known as the vital statistics study. Now, where is to be applied such biostatistics if you have a study? So since you are a PG student, you need to write down your dissertation, etc. So it is applicability there to write down, to correlate everything in that particular dissertation, etc. So I will take this slide only today, and thereafter I will have an open session because 5 minutes is left. So application of biostatistics is in anatomy and physiology. Why anatomy? Because different healthy persons have different height, different weight, different blood pressure, but there is a ratio, there is a range here to here. That is normal. But if it is below to here, it is again abnormal. If it is from the above to upper range, it is again abnormal. So that is to be studied. That what is like serum creatinine 0.8. That was range. Now it has become 0 to 1.4 serum creatinine. So it is also variable, and this variation has come because if you go through the old book of the practice of medicine, you will find that normal blood sugar level was in the fasting 70, and PP postprandial was like 120. But later on, nowadays, what we are saying that that range has variations. Now it is up to 110. It is said to be normal during fasting, and up to 140 is said to be normal if it is a PP. So likewise that it also varies time to time, and due to climatic factor, due to lifestyle factor, etc. There are several factors which affect these parameters also. So in anatomy and physiology, we apply biostatistics, study with the help of biostatistics. In pharmacology also, like action of drug, comparative study of some drugs in a particular disease. X and Y drugs, both are for a particular disease. Like you can understand like that. If it is a glycodin for cough syrup, it is related for cough syrup. If it is a Benadryl, so what is the efficacy of Benadryl in a certain group of person of cough related to likewise that study. Right now we are studying, we will be having a study what is related that how many persons were protected with the vaccine of COVID, how many persons were protected with co-vaccine, how many persons were protected with COVID shield. Was there any difference? Likewise, that we need to study, and that study has started, and soon we will come to know later on after 1 year that these are the studies result. So study is going on. It is a continuous process in the medical health science, so it is continuing. And to study the role of potency in medicine in a particular disease for us also. So there are several types of potency, several types of scale of potency also. It is said that a few diseases are very much few medicines are very much effective in LM potency. Few medicines are very much effective in the centimillesimal potencies. Likewise that, and accordingly in medicine study of particular disease with the control group. Control, I will discuss in the next class what is the control group, and likewise that incidences of filariasis in area wise. What are the area where the diseases filariasis is available, or the persons are get affected with the filariasis, or incidence of arthritis in the marshy area. So what is the difference if somebody is residing in the dry and hot area, and what is the difference of the arthritis patient if those patients are living in the marshy area? Or we can study on the basis of socioeconomic and disease incidences also, like symptom of a particular disease and particular syndrome, and diagnosis on the basis of symptoms. Likewise that some, you know what is syndrome? So syndrome is a collection of group of symptoms towards which indicate towards a particular disease is known as. Sometimes it happens that a set of disease together is related to a particular syndrome. So such is known as the syndrome. So such studies are being conducted, and there the application of biostatistics is there. And scope and application and usage of biostatistics in community medicine, role of vaccine. Right now we are going through, as I told you, that we have already studied the polio vaccine, because the polio vaccine is very much affected. Now it is at almost 0, and it has been eradicated, like a smallpox has already been eradicated. Study of prevention and whether the vaccine or COVID has prevented the disease of corona or not, attacks of epidemics also, that whether in environmental factors attack of dengue has subsided or not, like that. In general disease, in incidences of a particular disease in a particular area, in particular season, or in a particular socio-economic status, likewise that. And we can also apply it in the group and sex affected with a particular disease. Why group and sex? That particular age groups are prone towards a particular disease, particular group of or particular sex is prone towards a particular disease. As I was telling in the last class, that hypothyroidism is being observed mostly in the female or housewife disorders, as diabetes mellitus type 2 is being observed in the mostly male. Likewise that there are several other diseases also which are related, like UTI, recurrent infection of UTI is mostly related to the female housewives as comparison to the male. And at the same time, vital statistics, death rate, life expectancy, as we know that life expectancy has variations. Previously I will have an open discussion over the life expectancy later on. Male birth, female birth, that male and female ratio, we can come to the conclusion. So there are several application and scope of the use of biostatistics. So today I will stop here, and I will stop sharing this screen, and I will take another class next Tuesday probably on the biostatistics, and other classes of organ of medicine, etc. will be also be conducted, and accordingly when the schedule is there, it will be informed to all of you. So let us have a discussion at what you have understood till now,